Hey, good morning, Scurry County. I know it's a little late for us today, but we're going to go ahead and do a daily briefing now. I've got Dana Hartman with the Health Department with me. Thank you for coming, Dana. Appreciate
Absolutely.
it. She's got some information that she's better at explaining than I am. That's why I wanted her to come on. So, give you the numbers today. So far, we have 6 recovered today, 4 new cases. We have a total of 83 active cases, 100 recovered, and we still have the 1 death. 184 total cases. Yesterday, like I said, we had 17 new cases. That was 45 cases in 4 days. There was 142 in the month of July, and if you count today, that's going to be 148. There was 4.6 per day, 7 cases per day in the last, as of yesterday, there were 7 cases per day in the last 7 days. And it's from infant all the way to the elderly. There is no specific age range here, so it goes all the way through. The positivity rate was, before yesterday, it was 18%, and yesterday, positivity rate with those 17 positive, it was a 37% positivity rate. Over 4 days, it was 11.5 per day average, and there's been 47 new cases since Monday. I had to do some quick math. 41 was yesterday, and so add 6, that's 47. So we're not posting negative results, and we're not going to try to keep track with that. We've explained that a while back. Something that's come up is the nursing home, Snyder Oaks. If you remember, we got false positives early on, and had everybody retested twice, and we got 2 negatives back after that. I don't remember how many false positives there were, but there was a bunch.
Yes.
We have never once counted those. We never put them out there. Somebody else took those numbers and said that we had those positives. We never counted those numbers and never will, because it was found to be a faulty test. So to go back over the Snyder Oaks numbers, there were only 2 employees that tested positive and 1 resident. And those have all been on the recovered for several weeks now.
Yes, they have.
So that's a total of 3 cases overall at any point in time at Snyder Oaks. And like I said, we at no time have or will we ever count false positives. So that's some information I wanted to get out there to you. And Dana's going to have some information for you now.
I am. And as Dan said, we will not ever count the probable cases, antigens. We are not currently doing that until we actually have those firm numbers. We still continue to do PCR test only, and we make sure that those are positives before those go into our account.
Can you explain the PCR test?
What the PCR test is it's the nasal pharyngeal. It's where they go in through the nose and they do the test, and then it is either sent to Microgen in Lubbock, or they can actually do a rapid test out at Cogdell now, which has been wonderful.
Yes.
It has worked out so great, because if they have someone come into the emergency room, they can test them, and that way they know immediately whether or not they're COVID positive.
Right.
So it's just another layer of precautionary measures
Absolutely.
that they're taking out there. They've done an excellent job.
That's good. And that's about a 10 to 15 minute test.
Yes.
Right?
Yes.
And the other, when we send it off to the lab, is about 24 hours.
Correct. Yes.
Okay.
Yeah. And we're still at really the 12 to 24 hour window. So the turnaround has been fantastic.
Good.
This
Good.
entire time.
Yeah.
Cogdell has gone above and beyond working with us. We receive test and results from Cogdell, as well as all other surrounding areas. We have a lot of people that will go to Abilene, Big Spring, Midland, Lubbock, and there are a lot of test sites now.
Yes.
And we have the potential. There are some people that if they get a positive result, they will basically keep going elsewhere until they get a negative result.
Okay. All right.
Because those tests are not 100%.
Right.
What the PCR test right now is the most accurate.
Right.
And that's the reason why we stay with that.
Absolutely.
But with that being said, nothing is 100%. They're getting close.
Sure.
And it's getting better every day.
Good. Good.
So.
Yeah.
So that's PCR.
Okay, all right, thank you for explaining that. I just wanted to make sure that everybody understood what exactly that is. I'm not up with the lingo. I'm getting better at the lingo, but
You'll be a professional.
I don't want to be. All right, go ahead.
What we are seeing is a spike in the younger age groups. Is what we are currently seeing with these new cases that are coming. We are having travel related, which is people have gone on vacations, they've gone to camps, they have just basically gone out of town, and whenever they come back into town, they start not feeling well, they go get tested and they've been positive. Okay. So anytime we mention travel related, that is outside of Scurry County.
Okay.
So that, just to help as far as the definition, that's basically how we go as far as travel related.
Right.
And as far as community spread, I know there's some questions about community spread.
There is.
Community spread basically is large family gatherings. Mm-hmm. And whenever you have a crowded area or any crowd, any type of crowd, if you go to a birthday party, mm-hmm. 10 and over is considered a crowd.
Okay.
And if you are not socially distanced, if you're not wearing your mask, if you're mm-hmm. not following proper procedures,
right.
one of your family members can be asymptomatic and have COVID.
Absolutely.
And unknowingly, especially with our younger bunch, because mm-hmm. we're seeing a lot of our younger cases have no symptoms whatsoever.
Right.
And what they'll do is they'll go see their parents. They're going to go see their grandparents. Mm-hmm. Well, the next thing you know, we go from one case in a family to 5 to 10 cases, right. And then it spreads from there.
Okay.
And so community spread is considered Scurry County, our community.
Okay. So going to just any type of event. It doesn't have to be a family event. It could be a picnic at the park with
correct. A birthday party. Like we're seeing a lot of birthday parties that, yes,
okay.
that we're seeing cases.
Okay.
And then whenever we are doing our investigations, we're like, well, I haven't been around anyone. And then in the next breath, they said, well, we went to a birthday party and there were probably about 30 people there.
Sure. Okay.
And so that's community spread.
Okay.
Is what that is.
All right. Thanks for explaining.
Yeah. Yeah. I want to go over again, wear your mask, social distance. Mm-hmm. So important. Wear the mask. I know there is so much controversy right now.
There is.
Give it a chance. All we are asking is please just give it a chance.
That's what I'm asking too. I don't want to go into a shutdown.
No.
I will. I don't like that idea at all. My thought is we're seeing that we're not going up anymore. We're plateauing in Texas. And I think the mask is helping. So I'm not a fan of the mask. I don't like wearing a mask. I don't like being told to wear a mask. But I'm wearing a mask to give this an opportunity to work.
Right. Well, and school is about to start,
mm-hmm.
and which brings up another, we really, our children that are going to school, if they are going to be face-to-face, the parents really need to start working with their children now.
Right.
The proper way to wear the mask.
Right.
Please wear your mask. Don't share your mask. Don't trade masks because
right.
someone has a cooler mask than you do. And things like that could probably happen. But so if parents will start working with their children now, mm-hmm. because once they're all back together again, they're going to be so excited
right.
to be together. And mm-hmm. so the mask is going to be our best bet.
Sure. Right and remind them to wash their hands and
absolutely.
Give them hand sanitizer
yes.
to carry with them.
Absolutely.
And use it a lot.
And that goes for the adults too.
Absolutely.
Wash your hands.
Mm-hmm.
We can't say that enough. Wash your hands. Also, a couple of things that I want to bring up that we really haven't talked about much is eating healthy and mm-hmm. exercising.
Yeah.
A lot of people, ever since the pandemic, they have really gone into a cave, basically.
Sure.
There's a lot of depression.
Mm-hmm.
There's a lot of overeating. And people need to realize that you've got to take care of yourselves. Mm-hmm. You need to eat healthy, get out and exercise, get up and move.
Right.
Because it's easy to lay on the couch and watch Netflix, but that's not going to help your overall health.
Right.
We are seeing a spike in cases with people that are obese
mm-hmm.
and with diabetics.
Okay.
So we're seeing a spike in that area. And so eating healthy, exercising,
Mhm.
that to try to do the best you can
Sure.
and move. That will help with the depression.
Hmm.
That will help with any disease as far
Absolutely.
as that goes.
Yeah. Yeah.
So
So you're seeing a spike in cases without getting into HIPAA violations. Again, is there anything as far as information as how severe those cases are? Are they mild? Are they moderate? Are they severe? Hospitalized?
we are seeing everything from no symptoms
Mhm.
whatsoever to hospitalizations.
Okay.
We have not, thankfully, we haven't had that many hospitalizations,
Mhm.
but we have seen a lot of respiratory issues. We've seen a lot that it's just allergies.
Right.
And they're like, I have a sore throat. I've got a little bit of congestion. There's no way this is COVID.
Okay.
But if they're running a temperature, which is the main thing, if you're running a temperature,
Mhm.
you need to call your primary care physician and you need to go ahead and get tested.
Right.
Because there have been cases, I don't feel well, but I'm running a temp, so I'm gonna go get tested. Well, they're positive.
Right.
And the thing about it is, if they're proactive,
Mhm.
then they will know. Okay,
Right.
I have it. I need to go ahead. I need to self isolate. I need to stay away from my family,
Mhm.
and I need to stay home.
Right.
And that's what we keep asking. If you don't feel well, stay home.
Yes.
Please stay home.
And you said earlier that you've had some situations where, and we can't police everybody,
No, we
but you've
cannot.
had situations where people are not self-isolating.
Correct.
So,
We do have people that are known. They knowingly have coronavirus, and they are still walking around out in our communities.
Mhm.
And we are doing everything we can. We are making the recommendations, and they are going against all of our recommendations.
Right.
And doing what they want to anyway.
Which goes back to treat everybody as if they have coronavirus.
Correct.
And we've said that from the beginning.
Correct. And what I've always asked is just please use common sense.
Mm-hmm.
That is the main thing. If you're sick, stay home, stay away from your family members.
Right.
Until you know for a fact.
Mm-hmm.
Wash your hands. It's the same thing that we have said over and over again.
Right.
But you can look at the numbers. 184 cases in Scurry County.
Yes.
That's a lot.
Absolutely. Yeah. In the last week, we had 45 cases in 4 days.
Yes.
51 cases in 5 days. We had a bit of a spike a couple of weeks ago, and we're getting a bit of a spike now.
Correct.
So, yeah.
Yeah, and you can watch, it will kind of coincide with holidays and vacations,
Sure.
and you can just watch that curve and you can
Mhm.
see, okay, we're coming off of a holiday.
Right.
So you give it 10 to 14 days, and guess what?
Right.
There are those cases.
Absolutely. Yeah, and it's been, a little over 21 days since 4th of July, so it's been a little over 3 weeks.
Right.
So that's probably where we're.
It is, and you have those index cases. You have those that came off of July the 4th.
Right.
They pick it up.
Right.
Well, then they
And
pass it on unknowingly,
Sure.
hopefully unknowingly,
Mhm.
to others in the community.
Right.
And so there you go.
Absolutely. Yeah. Okay. What else do you have for us?
That's really, that's it. Just please, just use common sense.
Mhm.
If I know I have said that over and over.
Right.
And educate yourself. There are so many. Get on the CDC website. There is every kind of information for every situation on that CDC website.
That's a good point, because there's so much information out there. It's on Facebook, it's on Twitter, it's on news feeds. Where do you go to get the actual good information? Because you can get the whole spectrum. Masks work, masks don't work. It's causing problems, it's not causing problems.
Yes.
You can spread it this way, but you can't spread it that way. CDC is going to be the best place to get the information.
It is. That's where we get all of our information. That's where we get our guidelines from. It's up to the minute.
Right.
And as I said, it has information for any situation, for churches, for camps, for any kind of gathering that you need to have. They have actually guidelines already in place.
Right.
So that's really the best place to go to educate yourself.
Yeah, DSHS has some good information.
Yes, it does.
Yeah, also,
it does.
Scurry COVID page has good information on there. We have the links on there to some of these other ones. But don't just get your information from so-and-so said on Facebook, or I saw it on the news. Actually do your own research. Find out what the truth is. There's so much misinformation out there that it's easy to fall into one camp or the other based on that false information. So
That's true.
do your own research and go to CDC, DSHS, or to the Scurry COVID page and start and get your own information. Find out the truth for yourself, what's really going on.
And the health department, we're always there.
Mm-hmm.
If you have questions pertaining to COVID, if we can help in any way, please give us a call. Our phone number is 573-3508. And we do have an after hours if you do have questions or concerns.
Okay.
And I would like to say how much I appreciate my staff.
Yes.
Because it has been 24 hours a day, 7 days a week.
Absolutely.
And I would like to just give them a shout out and say thank you. And with that being said, they are extremely knowledgeable.
Mm-hmm.
And if they don't know, they know where to go to get the answer.
Yeah, I'll echo that. I think they're doing a fantastic job, and you're doing a fantastic job.
I appreciate that. You are too. We're all in this. This is uncharted territory.
It is. Yeah.
And that's one thing that people need to understand.
Mm-hmm.
None of us have ever been through anything like this before. Right. We are finding our way, and we're asking for grace and prayers. We really are, and we'll get through this together.
Yeah, we will. We will. And we'll see where it leads. We just need to find that, and I don't like this term, that new normal, and follow that new normal. And as much as I don't like it, that's where we are. We need to be what's going to be normal in the future. And right now it looks like wearing a mask and washing your hands and social distancing. Don't hug, don't shake hands, that type of thing. It's very hard not to give somebody a hug or to shake their hands.
Exactly.
But, or to touch your face. That's something we haven't talked about in months. We're not supposed to touch our face. And I still catch myself doing it. But,
Well, and that's one thing with the kids too, because the whole time they have that mask on, they're going to be playing with that mask. They're going to be adjusting it. And that's why the hand washing is so important.
Yeah. And
the schools have done an excellent job. They all have policies and procedures in place for this, and they're preparing. And they have worked extremely hard.
They have.
To come up with a plan that's going to work for the children. They're doing everything they can to protect our children.
They are, and we have 5 great school districts, and that's including all 3 other ISDs, the Christian School, and Western Texas College, and they all have great leaders who are doing everything they can to protect our kids.
Exactly.
And I feel like that they are doing the right thing for
us.
So remember, wear your mask properly. I've got mine here just to kind of demonstrate. This is properly. Pulling it out to talk is not properly. Wearing it under your nose is not properly. Am I missing anything? Hanging off one ear, under the chin. Wear it properly if you're going to wear it. So, all right. Anything else?
That's it for now.
Okay. Well, thank y'all. We'll talk to y'all next week, and y'all have a great weekend. Stay safe.